Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Welcome to Relationships Inside Out. Today we have another guest, Tandis Hashemi, and she's going to talk to us about her work in supporting people in crisis, suicidality, and hopefully give us some tips and perspective on how we can support people who are going through it.
Mm-hmm. Yeah, very difficult topic. And
yeah.
I think all of us know at least one person who might be experiencing this, maybe even ourselves. So I think this is important knowledge and perspective to kind of gain of how to even approach that or how to support someone who might be going through
Absolutely.
This. So, welcome, Tandis.
Thank you. Thank you guys for having me.
Yeah. Do you mind sharing? Just share a little bit about your experience, where you work, what you do. I know you're part of a new program, so that's exciting.
Yeah. So, I currently work actually as a co-responder in a new program that is an alternative response to PD when it comes to emergency calls that are mental health or behavioral health related.
PD
So they have been working
police department.
Yes. So we do typically, well, not typically, I think in the past few years, co-responder programs have been becoming more of a common thing. And there are a lot of places, I think, throughout the nation that have a co-responder model of an officer and a crisis clinician. My program is not paired with an officer. I'm paired with a paramedic or an EMT. So kind of just a different response, but we still take police calls that really, we go on a variety of calls, but really just anything that doesn't involve active violence or weapons.
Got it. Okay. And tell me a little bit about the function for this program. Like why is it important? Because they are in the uprise, right? I know California, San Diego specifically has PERT, Psychiatric Emergency Response Team, to help out with these. So what does that look like? Can you walk us through a typical call?
Yeah, absolutely. So typically, I think what we're used to is when people are experiencing any kind of an emergency or crisis, the first thing we maybe think of is to call 911. And a lot of times, officers may not have the specific training that's required to support somebody who's maybe having a mental health related crisis. And so the goal of the program really is to kind of support people in the moment who may be going through a behavioral health or mental health related crisis and kind of divert from emergency departments or jail or other criminal related charges if we can. So that's kind of the main goal of the program.
I love that because when we were in Florida, often they have something called Baker acting there, where anyone can Baker act. So if I think you're a threat to yourself, even if I'm not a mandated reporter, I can Baker act someone and the police show up, and it can be traumatic for a lot of people because they're often taken in handcuffs and put in the back of a police car. And it's not a criminal offense to have a mental health crisis. And so I love that there is kind of this division between the two.
Yeah.
It doesn't have to be as stigmatizing.
And there isn't a lot of training in the mental health stuff. I know some of the more recent funding since the issues we've had kind of in the media around the police's response. So training in that regard, but they have a ton of training already. So I find value in bringing somebody who's gone to school for several years, specifically for mental health, to be a part of this, especially, I think you're in Denver, right, Tandis?
Yes.
And so, the resources there, who to connect to. And that's really a hard part for a lot of us is, who do I call? What do I do? Because not every, like, for example, suicidality, those thoughts are very normal. A lot of us have had those, and the majority of people who have them aren't going to go through with that, or we don't need to call 911 or emergency response for that. And most of us don't know that. But what do you do when that does come and you really feel like it is a severe, potential?
Yeah, absolutely. I really like what you said, Kim, about the traumatizing aspect with, police response. And I think it's a lot of times, I know myself included, we tend to associate anything when we're interacting with police as like a punishment, right? Like you're in trouble. And I've worked in inpatient hospitals. Actually, the majority of my experience has been in different crisis settings. And a lot of the conversations that I've had with people who have been hospitalized after having, maybe thoughts of suicide or maybe experiencing psychosis, and they've been like the support that they received was through police, they feel like they're in trouble. Sometimes even the hospitalization piece of it feels like they're in trouble. Like, I shouldn't have talked about this, or I shouldn't have said that. And I think a lot of it really has to do with the supporting individual's ability to kind of explain, like, why are we doing this, or, kind of help psychoeducate or go over maybe what the process looks like. Because I think a lot of times it's like, this is the next step. And that is very traumatizing for a lot of individuals.
Yeah. And Tandis, do you mind sharing a little bit about what you're looking for on these calls? What are some things that you're paying attention to? And
yeah, I think when it comes to specifically thoughts of suicide, like you mentioned earlier, it is pretty common, right? It's just not a thing that we talk about a lot of times. And I think even honestly, I think a lot of mental health professionals who maybe don't have crisis related experience or haven't worked with that, there's this initial fear, right? This immediate
Panic.
Oh gosh, like we need to, yeah, exactly. Like we need to call emergency services.
Yeah.
Right. Which I get that, right? Because of course, anytime that someone voices something like that, we want to take it seriously and we want to make sure that we get them the appropriate type of support. But I think there's maybe some confusion or lack of understanding on what that appropriate support may look like. Just because somebody voices that they're thinking about death or thinking about killing themselves doesn't necessarily mean that they need to be hospitalized or that they need a visit from the police or even my program, right? From a crisis clinician and a paramedic. Just because it's not always fun to have someone show up at your door. So a lot of what I'm looking for, or I guess how I approach it, is just kind of this very collaborative way, and trying to understand, like, what is this person's relationship with their thoughts of suicide? Because I think the other thing is that as a field, or just as a society, we think that it's not okay to have those thoughts and we want to get rid of them. But for a lot of people, it is a sense of comfort, and actually taking those thoughts away, or telling them that it's not okay, can really increase or intensify and do the exact opposite of what we're hoping. So
interesting.
Can you share more about that piece, Tandis? Because there is a lot of stigma around that of, if I'm having these thoughts. And so let me be clear about something really quick. When we talk about it's common, follow through attempts, less common, right? But this thought of, I just don't want to be here anymore.
It'd be easier if I wasn't here.
Easier, people would be better off. That is the common part.
Yeah.
But Tandis, can you share a little bit deeper into what you were just talking about?
With the relationship.
Yeah,
absolutely. I think, there's this idea maybe that, like I was saying, it's not okay to feel this way, right? To have thoughts of suicide, to think about killing yourself, wanting to end your life. I think a lot of people do think about that at various points of their life. A lot of it can be related to just experiencing a lot of pain, feeling like there's, no other way that could, alleviate their stressors or what it is that they're going through. And that could vary for person to person. And I think, when we're kind of looking at what is this person experiencing, what is their relationship, what we really want to understand is, where are they with these thoughts on a daily basis? So kind of like the baseline of like, okay, so if you have these thoughts all the time or have had them since you were, 12 years old, can you tell the difference? Because really the individual that you're working with knows best, right? They're the ones that experience these thoughts. And so it's really just about having a conversation around, what does this look like for you? And what happened today that's maybe bringing up these thoughts? Or, in crisis, I think it's a little different in outpatient therapy or conversations we might have with family or friends. But in crisis, we really want to focus on like today, just because that's kind of, we're trying to provide that in the moment support. But I think, other conversations, it's like, okay, well, what's been going on? Let's brought this up, right? And everybody always has an answer for that. And it doesn't matter how maybe minor their answer seems to you, right? Like we always say that crisis is self-defined. And I think, everybody's, way of experiencing it is also self-defined, right? So just getting an understanding of what it looks like for that person and what's been going on, and being able to have an open conversation about it. I think that that's the thing that's really missing, is because we get so scared, like you mentioned, kind of go into that panic mode. It causes us or maybe the other person to then shut down, which is really not what we want to do, right? I think there's also like a myth that if you ask someone, are they having a thought of thinking about killing themselves, that brings up the thoughts for them or increases their chance. And that is absolutely not true.
Right. Yeah, there's no research to support that at all.
But we see that in other topics, right? Like parents, even if parents talk about sex with their kids, they say, I'm not going to talk about it because it'll make them interested. Or I'm not going to talk about someone's grief or loss because it'll bring up that pain for them. And there's no truth to that. That's all human and anxiety kind of fear.
And especially, I think that's important what you talked about, Tandis, because in the context of suicidality, a lot of people are afraid to ask directly.
Yeah.
And because of that, and like that myth that you just talked about, afraid of what if I put that thought in there, and there isn't research to support that when you say it, they're going to think of it. And then also I like what you're talking about, the non-judgmental piece, having a conversation. A lot of people might not feel like they're connected, and being there and having a conversation with them is an important way to support in a non-judgmental way. Don't try to fix it, just listen and help them feel connected. And that is a protective factor as well. So I love that.
Yeah, I like that you mentioned that, actually, because I think the biggest or most common part for a lot of people who experience thoughts of suicide is this lack of belonging or not feeling connected to other people. And so really the biggest thing or the most supportive thing that we could do, whether it's, in our work as professionals or as, friends or family members, is really just offering that safe space to talk through what it is that's going on, and helping that person feel connected and supported, and like a sense of community, right? I think a lot of the safety plans that I do with people incorporate supports, right? So like, who is someone that you can talk to? Who makes you feel safe? Who's not going to, judge you for this? And I think it's, it's really, really hard, especially for kiddos. It's a scary thing for parents, right? And so a lot of times we're saying things like, don't worry about it, like this is just a phase in your life, it's going to pass, or, it's, people have it worse, or like, don't do that. Like, don't,
well intentioned, but super invalidating.
Yeah. Right. And it's like, that makes the person feel like this is the whole reason, I'm feeling this way, is I feel like I'm not getting that. And so you're kind of dismissing what's going on for me, which could really just do the opposite again, right? Intensify those thoughts and feelings and make the person isolate themselves even more, which is not really what we want.
Yeah. And you said a lot of good stuff there. I did want to talk about what you just said at the end too, isolation. Let's talk about warning signs, things that people can look for. One of them is isolating more. Like you notice they're not as interested in things, not as sociable.
And I want to clarify something. So warning signs about when we should be worried about suicidality, or because it is common, right? These thoughts of suicide can be common. So are we talking about warning signs and when we should get crisis?
When we should check in, when we should ask them, and maybe even be direct about the question of suicidality, right?
Yeah.
When we notice like, okay, for them, like this is not normal. They're literally just hanging out by themselves in their room and not talking with anybody. I need to check in. Doesn't mean that they're suicidal, but I think that's a sign to definitely check in. But I'd love to hear what your thoughts are, Tandis, around some of these signs.
Yeah, absolutely. I think, like what Kim mentioned, there's a difference between risk factors and warning signs, right? And so I think when we're thinking about warning signs, it really could vary from person to person, which again is important to, pay attention and have conversations and maybe point out things that you've noticed that are different. So if someone is typically very calm, but they seem very irritable lately, it's okay to kind of open that door of like, hey, what's been going on? And then through the things that they're sharing with you, I think, at least in the work that I have done, there's usually little hints, right? So if you're hearing signs of maybe hopelessness, hearing signs of just, so not just the isolation, right? But if someone is maybe keeping to themselves, but also maybe start doing little things like, getting things of their life in order. If they would say like trying to do specific things or meet certain, make sure that everybody in their life is set up, or you can see that they're actively working towards something, but they're not able to maybe identify the goal. And I think if you know that someone has ever had a history, it's always okay to check in and have those conversations. I think the one thing that I always tell people is, if you ask them whether you're coming in a professional capacity or if it's a friend or family member, and if they say no, don't respond with, okay, good. Because I think that's kind of this message of like, oh, good, you're not having those thoughts. And so then it's going to make the person feel like if they are having the thoughts, that's not good. And they can't talk to you about that.
And then what are some of the risk factors that can set people up to be more at risk of experiencing crisis or suicidality?
Yeah, absolutely. I think substance use is the first one that pops into mind, just because it can be, it alters our minds in a lot of different ways. And so it could definitely, and there's a lot of stigma, again, that's associated with substance use, and a lot of guilt and shame that goes into that as well, because we don't often create a safe space for people who struggle with addiction. So that could definitely be a risk factor. And I think, maybe an increase in anger or aggression, definitely any sort of trauma history. If someone has prior attempts, that's definitely a risk factor. A big one is exposure to someone else's death by suicide. That could be a major risk factor as well. People experiencing homelessness are often, at higher risk, and then of course, lack of support, isolation, not feeling like that, the piece of the belongingness and not having a sense of community. And then, access to lethal means, so firearms and familiarity with that, right? Knowing how to use it. And then, chronic medical issues, definitely. I think a lot of times people who have a chronic medical diagnosis, that they're experiencing pain, or, that could lead to a lot of feelings of helplessness, hopelessness, and could just really put someone at a higher risk. So it's just important to kind of be aware of that and have those conversations.
Such good insight.
Yeah. And also too, kind of to add a little bit, is those who have a plan, right? I think the research around that is like around, if someone has a plan, like a detailed plan, it's around 38% increased.
Plans, intent, and means
are
the big ones, right? Like, do they have the way of doing it, the actual plan to do it, and then the will or drive to do it?
Yeah. And someone supporting somebody who is in crisis, right? And has really made it clear that they want to commit suicide. Help, like, what are their means, and really understanding what that is. And we need to know, because taking those away is a big protective factor. Finding ways to remove those means from them is helpful. Understanding their plan to help maybe interrupt in that realm.
Yeah. Tandis, do you have tips for family members, friends whose loved ones may be struggling with this? How can they offer effective support? What should they be looking out for, and what should they do when they see these warning signs, that kind of thing, but to give some direction?
Yeah. I think before I answer that, I just want to mention, so what I had said earlier about understanding the baseline, right? So there are a lot of people who have chronic thoughts of suicide, and as part of their everyday thought process, they may have a very specific plan. They may have, the intent even, but I think it's just understanding, like, is this what you're thinking about every day? And is today different, right? So is there higher intent? I like to ask scaling questions, to kind of identify that. And if everyone, or if some person is at maybe a 7 on that scale every day, but today that they're at an 8, that's something that, I want to talk to them about. But if today they're at a 5, when every other day they're at a 7, even if they have a plan and the intent and, have the thoughts, it's kind of just the way that we look at it. And again, I think why it's so important to understand that individual's relationship with their thoughts and kind of what that looks like for them, so that we're not jumping to, the most intense, right? Like we want to come from this least, this is what I always say, at least in the work that I do, least restrictive, right? So if we can have a conversation, process through this and come up with a safety plan. And like Greg mentioned, removing access to means, that is, the most helpful piece of it, right? Because hospitalizing someone doesn't take their thoughts away, right? There's actually a lot of research that talks about how people who experience thoughts of suicide are, maybe even acute or really high risk for attempting or dying by suicide, are at a much higher risk for a 60-day period after a hospitalization. So if we can avoid that by bringing in supports and restricting access to means, and coming up with a safety plan that is helpful for that individual, not one that makes us feel better as the person that's supporting them, but one that actually works for the person. I think that's really the best way to handle that.
And what would you include in that safety plan? Like, what are some things, like, because you don't have people who are supporting an individual who might be going through this, you don't have to be trained in this, right? You can do a safety plan with that loved one or friend. And what are some things you might want to include?
Absolutely. I think talking about warning signs, so especially with family and friends, if you're able to identify, hey, these are the things that I've noticed that are different, maybe, and asking them, like, how can you tell when things start getting really bad for you? What happens for you, right? What goes on in your body? What are the thoughts you're having? What are the emotions you maybe experience? What do you feel like you do differently? And if you're able to add to that as like, well, I can tell that, you're really mean sometimes and you get grumpy and you shut yourself out. You don't let me talk to you. Whereas normally we're able to process through these things, or, so those are some of the things that maybe I'm noticing, and having, the individual also identify kind of some of those things that feels different for them. I think that's the biggest piece, because we want to help them be able to identify when it's different. I think a lot of times when we're in a state of crisis, it's hard to think through like what's going on, right? I get from a lot of people like, oh, I don't have warning signs, that just happens. And it's like, it may happen really quickly, right? I think it could happen for all of us. So at times where you can go from sort of 0 to 60 or 100, but it doesn't mean that there aren't things that are happening in that, right? So kind of just helping them identify that. And then the other big parts of a safety plan, if there is a plan, and thinking about, the ways that you would do it specifically and have access to those means, then coming up with creative ways to restrict access, right? So like it could really be, I think this is what's, the biggest thing when it comes to restricting access. We think that we need to completely remove those items, right? But if someone's plan is associated with a knife, I mean, you can't get rid of all the knives in your kitchen, right? But maybe you can take all the sharp ones or the ones that you thought about using and stick them in a shoebox and maybe put the crisis lines number, like tape up the box. I think that's the biggest thing. Yeah, just it's really about, again, like you want to create some sort of distance maybe, and make it a little bit more difficult to kind of get to the means. It doesn't mean that they need to be completely removed. So if somebody has access to a firearm, are they willing to take it apart, right? So that if in the moment where they have to put it together, because that's what the research shows us, is that from the time that you're wanting to act on the thoughts, your accessibility to the means is really the, a big piece of it. So if you have to go through and like put your firearm together, or, go into your closet to take out the pills or the knives, and then it's taped up and now you have to cut it open, and then you see the number to the crisis line. A lot of times, that could get someone to remember and ask for help, especially if they are having these conversations, right? If they're voicing it, there's a part of them that wants that support, maybe just doesn't know what that support looks like. And so, and then having phone numbers, I think like I like to have written down safety plans, but there's actually an app, My 3. It's just my and the number 3, that's free. And it is a safety plan. You can just, that goes over warning signs, supports, and I believe, I haven't used it in a little bit, but once you put your contacts in, it can even sync with your contacts. So if you, list mom as a support person, if you click mom, it can just call mom, right? Or have the number to the crisis line in there or something like that. And just kind of, talk about it. And I think those are, probably the most important pieces of a safety plan is going through the warning signs, supports, and trying to talk through restricting access to means.
And that support too could look like having a number on there for the local crisis center or local psychiatric hospital, right?
Yeah, absolutely. I recommend, I think hospitals, and if, there's a therapist that the person has, definitely helpful. I think the crisis line is a really good resource just because those people are trained and work with that all the time. And it's not, they're looking for very specific things. They're not going to just send someone, to their house. And that's I think the scary part for a lot of people. Like if I talk about this, they're going to, people are going to show up at my house, often police, right? And they're going to take me away. And that's what a lot of people try to avoid, which isn't always the best thing for them, right?
So aside from a safety plan, what do you recommend for those loved ones on how to support their loved ones that are struggling, when they should call 911? How does that look? That kind of process. But how can we support people who are witnessing this?
Yeah, I think, again, I feel like the biggest thing is just talking about it, creating that space where it's okay to have these conversations. Maybe coming up with, as like if you've done a safety plan, like, hey, if you notice these changes in you, can you please just call me? And then showing up, being with that person. It doesn't have to be forever, right? It doesn't have to mean that you move that person into your home and never take eyes off them, because that's not really realistic for any of us. But it might mean, having a couple of sleepovers, or just kind of checking in a lot more, right? And letting them know, like, hey, please just, if I call and you don't want to talk, just text me back and let me know that you don't want to talk, right? Because I can give you that space, but then I'm going to check back in maybe in a few hours, right? So really just being there, I think physically, is much as possible, and if not physically, then just checking in, and then again looking for if how much things are changing, so that you can have a better idea of when you need to maybe contact professional support, right? And if you could be there for that too.
Oh, sorry, go ahead.
So, I was just going to say, if you can be there for that part of it too. I think a lot of times family members or friends call 911 and request a welfare check. But I think if you could be there physically with the individual, and let them know, like, hey, I'm really worried about your safety. Can we drive to the hospital together? Can we go into the crisis center together? Or is it okay if we call for help together? I think a lot of that feels a lot more supportive, and things that we can do as friends and family.
Yeah. And I like what you're saying, because a big part of that is being there with them, especially through the intense emotions that might maybe even lead to a follow through. And those can last a day or two. So just being there. And also what you talked about too, is you can be a part of, if that person's comfortable, making an appointment. Maybe that's an outpatient provider. Maybe you don't go to the level of the hospital, but let's make an appointment with a therapist and we'll go together. And if that's telehealth, do you mind if I'm with you until that appointment starts? Like on maybe even like video itself. But finding ways to even be through that process, because even navigating the mental health networks can be stressful, and helping take away a lot of the barriers they might face when trying to seek help, which is kind of what I'm picking up from what you're talking about too.
Yes, absolutely. It can be very overwhelming too. I think a lot of times people can identify that they need additional support, but kind of going through that process can feel really discouraging at times, right? And I mean, you know, it's hard. I wish that we had more access to care, because sometimes you have to wait for a long time to get that first appointment. And so again, what's really important as a family member or friend during that time period is to just show up, right? And check in. And also, I think, you know, depending on how concerning the thoughts are, we don't want to force professional support onto someone either, because then that again ties back to the feeling of, okay, like you're making me go talk to someone, or am I in trouble kind of thing, right? So it's really just sharing your concern and coming from a place of like, I think it might be helpful to talk to somebody about this, to have a place where there's no one else there and there's no judgment and it feels safe to talk through some of this stuff. And like you said, Greg, like, can I be there with you? You know, I don't have to be there during the appointment. I mean, of course, if they want you to be, great, but otherwise it's like, yeah, can I drive you there? I'll hang out outside, or can I be there until the session starts if it's telehealth, and then I'll leave and come back, right? I think all of that is, again, back to the connectedness, right? And the sense of belonging and the support and kind of that, yeah.
Do you have any tips for the supporting person for self-care, to not take on the full responsibility, full guilt, right? I hear that a lot from people whose partners or friends are suicidal or in crisis, and they feel wholly responsible to make sure that person is safe all the time, and they feel guilty if anything happens. Do you have any tips for them?
Yeah, I think having your own set of support, right? And talking about how overwhelming or scary it can be to have someone that's close to you that's going through that. And then making sure that you have, a plan for yourself of like, okay, I'm going to check in around this time every day. And then, I'm going to do this afterwards, whatever it is for you. That could be, calming or relaxing, maybe distracting, and then being able to come back to that. I think it's a lot easier said than done, but really just working to understand that you're not actually responsible, right? Like, we don't have control over other people's actions, right? I think as much as we want to sometimes, we don't, right? And so I think knowing that, hey, like I'm part of this as much as I can be, and doing the best that I can. But at the end of it, there's, I can't control what this person is doing, and kind of reminding yourself of that. Again, so much easier said than done. But I think, if you have those conversations with your supports and kind of check in with yourself, over time, it gets a little bit easier. And again, I think that the part of when you have that collaborative safety plan with the individual that's experiencing, you kind of can look at it as, okay, these are the ways that they want my support. So this is how much they're allowing me to be part of this. And that can kind of help accepting that you can't control what they do as well.
And I, in this context of this, what you're talking about right now, I love the fact of going back to what you said a couple of times about knowing that relationship. And if you know that they're always at a 6 and they're at a 6 today, maybe in a 5, that we can maybe take a step back and they're okay. And that can help as serving as a way to understand to what intensity I need to be involved. But again, I love what you said. It's not responsible. We can't control what other people are doing.
And leveraging maybe their other support system, right? So if they have several support people, taking solace in those other support people, or encouraging them to reach out to those other support people, if we're not feeling like we have the capacity to give in maybe the way they need in that moment too.
And that's okay. Yeah. Tandis, I had a question for you too about, because how long you been doing this?
Well, since technically 2014. I've worked in a variety of settings.
So 8
I've been
years
residential.
or so.
Yeah.
And how many times have you experienced maybe somebody calling on a family member because they're self-harming but not suicidal?
Ooh, good question.
Yeah. A lot of times, actually, unfortunately, I think a lot of mental health professionals do that as well. And I think what you had said earlier about a lot of times people are afraid to ask directly. I think a lot of times what we do is ask someone, are you thinking about hurting yourself? And that, maybe to the person asking means killing themselves. But to the person who's receiving that question, it could mean so many different things, right? And there is, I think a very big misconception that people who engage in self-harm are definitely suicidal or going to end up attempting or ending their life. And that's just really not true, right? I think there's a really big difference. And again, it's just really, really important to have those conversations, because people who do engage in self-harm have a reason, it serves them a purpose. And so having an understanding of what it's doing for them, and why it is that they're engaging in that, sometimes people do it as punishment. Sometimes it's to feel something because there's maybe numbness. It really just depends on the individual, right? And so having an understanding of why, and then they'll tell you, right, that it's different. And so being direct about, are you thinking about hurting yourself, or are you thinking about killing yourself? And not clumping those questions together, right? Because if you just get a no, how do you know which one they're saying no to? So yeah, big misconception. Definitely. I mean, there can be a correlation, right? There are people who experience thoughts of suicide who also engage in self-harm.
Right.
Doesn't mean though that they go hand in hand.
And trusting their answer, right? I'll see sometimes like caregivers, loved ones saying like, well, are you sure? You sure? Or, well, you're harming yourself, so you must want to kill yourself, right? Making these assumptions. And I think that does more harm than good. So if they're saying, yes, I harm my body and I'm not suicidal, as hard as that is for the receiver to hold that tolerance, to not respond in our anxiety, also respecting the truth in their statement, right? And the right to have truth in that statement.
I love that you said that. I think that because it tends to be such a scary topic for a lot of people don't believe, the answers that they're getting. And that's not a good feeling either, right? I don't know about you, but I don't really like it if my support person doesn't trust my answers and things, right? That makes me not want to talk about whatever it is that we're talking about, because I'm going to feel like, well, you're not going to believe me anyway. So why are we having this conversation, right? So I really love that you said that, because that is a very big part of it. Very important.
And that's a big theme that we've kind of hit on today, was be curious and non-judgmental. And part of that curiosity is examining the relationship with the suicide, examining how you can be of support and what they need in that moment.
Curious with ourselves too, right? If I'm feeling intense anxiety and angst and urgency, that may be work that I need to do with myself. It may not be about the person I'm sitting with, right? So if I'm sitting with, say it was my partner, this is not really my husband, but say it was my partner, and he was thinking about suicide or he was self-harming, my sense of urgency or anxiety isn't necessarily about his sense of urgency or plan.
Right.
That can be more my anxiety coming through. So really exploring too, as a support person, your emotional reaction. What do you need for your emotional reaction? How do you monitor yourself in that space, so we don't intensify the situation or further stigmatize the situation?
Yeah, absolutely. You don't want to overreact also, right? But it's scary and it's overwhelming. But you just want to have that peace and insight into, like you said, kind of what's coming up for you and how can you hold the space for the person, and then do what you need to do to take care of what's coming up for you after the fact. I think that's really important. The other thing too that I forgot to mention earlier, I think a lot of times we identify people who experience thoughts of suicide, or maybe have had attempts or even died by suicide. As a society, I think a lot of times we think of them as selfish. And so you get a lot of support people that do the, like, how could you do that? Like, what about, your kid, or what about your partner? What about your mom? Like, what would they think? Right. And it's like, that's not helpful, ever. It is really, really not helpful. And I can understand maybe the the thought process that goes behind that of like, you're like, no, but these people care about you and they would be so devastated. But that's not really helpful for the person who is experiencing the thoughts of suicide, right? Because again, they're feeling like they're a burden. They're feeling like they don't belong. That connection isn't there. A lot of times there's this like thought that these people would be better off without them. And so, making that person feel selfish isn't really, it's just not helpful. So if we can stay away from those kinds of responses and just kind of really voicing like, I know that your mom really cares about you, or I know that your partner really cares about you, and just kind of leaving it at that, right? Maybe talk to your partner about this and kind of encouraging them to have those conversations with the people that they're concerned about, not caring or being better off.
Good point, right? We try to have answers or responses to people out of kindness or out of love or what we think is going to help. And sometimes it can make it worse. And so really checking in with how are we responding? And is this helpful? Is this actually benefiting the receiver? Or could it actually make things worse or not be helpful at the minimum?
And going back to what you said, checking in your own anxiety and how much of these questions are resolved around you resolving your own versus actually being supportive. So,
Tandis, any other last thoughts about those who might be experiencing suicidality or self-harm or crisis, those who are supporting those people, other therapists or caregivers in this system?
I think the biggest thing, and I've probably said this so many times throughout our conversation today, is really just, it's okay to talk about it. But then if you're on the receiving end, make it okay to talk about it, right? That's kind of my overall hope, I guess, as a takeaway, is just creating that space and knowing that there are people that can, if you're experiencing thoughts of suicide, finding your support person that you can talk to. And honestly, the crisis line is a great place to start, just because, like I said, there's no judgment. I used to work on the crisis line for a couple of years, and a lot of times people would call in and be like, do you have a button that you hit? And people will show up at my house, and it's like, nope, we're not even associated with police. We're not, there's no connection with dispatch or anything like that. So we just want to have a conversation. I imagine that there's something going on that led you to reach out today. Let's talk about that. And so that could really be a great place to start. And then having more in-depth conversations likely with the crisis specialists on the crisis line about bringing in supports and how you can have those conversations. And if you do have a therapist and maybe want to tell your partner or your mom but don't know how to bring that up, maybe asking your therapist if it's okay to have a session with that individual, just to kind of have that safe space to bring that up and talk through. And yeah, just talking about it is okay, and thinking about it is okay. It just kind of depends. So
I, for one, am so grateful for the way you serve our community. So thank you times a million. I know it's not an easy job to do.
Yeah.
And the amount of compassion and your own self-care you have to do. So thank you so much, not just for being here, but really for the service you offer for our community.
Thank you.
Well, this has been Relationships Inside Out with Tandis, who has, even as a therapist, has opened my mind up to things I didn't think about or know. In how to support those who are in crisis or suicidality. As always, if anyone has any questions for us or for Tandis, feel free to email us at relationshipsinsideout@gmail.com, or if you have topic suggestions. But again, Tandis, thank you so much for being here.
Yes, thank you.
And we thank everyone for listening.